Good.
It is connecting. I'm gonna record, let the public in. Recording. And Sonia making you the host. We're good to go.
Am I already the co-host?
Mm-hmm.
Okay, perfect.
Okay. Welcome, everyone. I am Tom Sherman. I am State Senator from District 24 and Chair of Senate Health and Human Services. I'm opening the hearing today for the Senate Health and Human Services. Today we will be hearing various bills. Actually, we'll hear one bill. Before we get started, I will be reading through a script or a checklist that's required to ensure that the meeting we are holding is in compliance with the right to know law. As chair of the Senate Health and Human Services Committee, I find that due to the state of emergency declared by the governor as a result of the COVID-19 pandemic and in accordance with the governor's emergency order number 12, pursuant to Executive Order 2020-4 and its extensions, this public body is authorized to meet electronically. Please note that there is no physical location to observe and listen contemporaneously to this meeting, which was authorized pursuant to the governor's emergency order. In accordance with that emergency order, I am confirming that number one, we are providing public access to the meeting by telephone with additional access possible by video and other electronic means. We are utilizing both YouTube and Zoom for this electronic meeting. All members of the committee and selected legislative staff have the ability to communicate contemporaneously in this meeting through this platform. And the public has access to contemporaneously watch or listen to the meeting on Zoom and also on YouTube. And via phone following the directions and links provided on the general court website. We have provided public notice of the necessary information for accessing the meeting in the Senate calendar. We are providing a mechanism for the public to alert the public body during the meeting if there are problems with access. If anyone has a problem, please email. Somebody tell us the email.
remotesenate@leg.state.nh.us.
Can you repeat that one time?
remotesenate@leg.state.nh.us.
Thank you. Or call the number.
603-271-3043.
Let's do that one more time.
603-271-3043.
Thank you. In the event the public is unable to access the meeting, in the event the public is unable to access, the meeting will be adjourned and rescheduled. Please note that all votes taken during this meeting shall be done by roll call vote. Finally, let's start the meeting by taking roll call attendance. When each member states their presence, please also state where they are and if anyone else is in the room with you during this meeting, which is required under right to know law. I will call the roll and we'll start with Senator Fuller Clarke.
Senator Fuller Clarke, yes, I am here and my husband is passing through. But
Okay.
I am in York, Maine.
Thank you. Senator Chandley.
Good morning. This is Shannon Chandley. I am at home in Amherst and I am alone in this room.
Senator Bradley.
Yeah, good morning, everyone. Jeb Bradley. I'm here in Wolfboro, and from time to time, Napoleon may show up. I know he wants to say good morning to Sonia in particular.
Senator Gray. Is he muted?
I've asked to unmute him. I think he needs to unmute himself.
This is Senator Gray. I'm here in my home in Rochester, and I'm alone in the room.
All right. let's see. We are opening the hearing on HB 1623 FN relative to telemedicine and substance use disorder. Representative Marsh, will you introduce your bill?
Good morning, everyone. I don't seem to be able to turn my camera on. I hope that's not a problem. Can you hear me?
Yes, we can. Thank you.
Thank you. Good morning, Mr. Chair and members of Senate Health and Human Services. For the record, I'm Representative William Marsh, representing 7 towns in Southern Carroll County. And I'm pleased today to introduce to you House Bill 1623 relative to medication-assisted treatment by telemedicine and telehealth services. And I do support it, as well as Senator Kahn's amendment, which I understand you'll be discussing later today. House Bill 1623, as you received it from the House, is a merger of my original bill and Senate Bill 647, which you heard in your committee and was a request of DHHS to address the need for providers to initiate substance use treatment in the Doorways program. Last June, I read in AMA News that Yale University was expanding substance use treatment. Excuse me for a minute, I got to turn the phone off. Life is interesting. Yeah. Last June, I read in AMA News that Yale University was expanding substance use treatment via telemedicine to veterans in Maine through VA clinics, utilizing the recently adopted special exception in federal law, but was not doing so in New Hampshire because of our state law prohibited this. Our veterans deserve to be taken care of as well as those in Maine, and so I immediately decided to file this bill to correct this matter. Over last summer, because of the Smith versus Aroostook County decision, we all became aware of the need to expand substance use treatment to our county jails. However, locally in Carroll County, we had at the time no local practitioners trained in initiating substance use treatment. Telemedicine is a logical way to expand access, so I added that to House Bill 1623. Last September, the New Hampshire Hospital Association contacted me asking to add hospital emergency rooms to this bill. Emergency room physicians also lack the training to properly initiate substance use treatment, but by allowing qualified individuals to initiate that in the emergency room via telemedicine, we can get individuals the service they need when they need it. Now with COVID-19 among us, my bill has taken on more significance as telemedicine has proven essential to care for patients with the social distancing required in this pandemic. Governor Sununu recognized this in Emergency Order Number 8, and I'm glad my bill is able to provide a vehicle to make these changes permanent. I thank you all, and I will be glad to take questions.
Thank you, Representative Marsh. First two housekeeping items. Although I introduced myself at the beginning of the call, I didn't introduce myself again at the roll. So for the record, my name is Senator Tom Sherman. I am in Rye, and I am alone. And the other flash item is that we have over 35 people wanting to testify. So there will be a time limit on testimony. Each person testifying, except for the person introducing the amendment or the bill, but that's done, they will not have a time limit, but everyone speaking thereafter will have a 3-minute time limit, and there will be a timer, and you will be asked to stop at the end of your 3 minutes. So as many of us who have been through these hearings many times have known, it's really important that you submit written testimony if you have it, and that you make sure you pick the most important points in your testimony so that in your verbal testimony. So I apologize for any problems that the 3-minute time limit imposes, but that's very important for us actually being able to complete this hearing. With that said, Sonia, are you calling, or is Ava calling the people for testimony? Okay, Sonia, if you'd go ahead.
Were there any questions for Representative Marsh, or are we moving on?
Any questions for Representative Marsh? Seeing none, thank you, Bill.
Okay, next we have Dr.
And this is, just to reiterate, this is testimony on the bill, not on the amendment.
We have Dr. Jonathan Ballard from HHS.
Dr. Ballard, welcome.
Good morning, Chairman. The Department of Health and Human Services is very pleased and supportive of this bill, specifically regarding the provisions that relate to the Medicaid program. The department is very thankful for the work that Representative Marsh and others have been performing on improving access to services through telehealth over the last several years, including previous legislative study committees and previous bills. The department is supportive of this bill. The department does wish to include a sentence after line 26 on page 2 to include that all services delivered through telehealth under this section shall comply with all applicable state and federal law or regulation as allowed by the Medicaid program. Any conflict with the provisions of this section in federal law or regulation shall preempt and supersede any provision of this section. This sentence was submitted as well to Senator Kahn and to Senator Sherman in advance of today's hearing. The only reason why the department wishes for this to be included is that lots of guidance have come out from the federal government regarding telehealth and its regulation of the Medicaid program in New Hampshire for services that can be delivered. And we want to ensure that this bill continues to allow the program to honor those restrictions that are placed upon us by the federal government, specifically the Centers for Medicare and Medicaid Services. With that, thank you very much, Senator Sherman.
Thank you. Dr. Ballard, have you been able to look at the amendment and make sure that has been incorporated?
Yes, sir. It has been incorporated from the amendment that I was able to see. Thank you.
So, okay, so you're all set with the amendment. It works for you?
Yes, the department is agreeable with the bill as amended.
Awesome. Thank you. Are there any questions for Dr. Ballard from the committee? Seeing none, thank you.
Thank you.
Sonia?
So next, I believe Senator Kahn wants to speak to the bill.
Senator Kahn. Is he muted?
I think he's muted on his end.
Good morning, Senators. Mr. Chairman, thank you for the opportunity to speak. Just point out that Senate Bill 647, which passed the Senate in a I think it was a unanimous vote, has the same content as House Bill 1623, with the similar intents of enabling the authorization for assisted medical treatment of an underlying substance use disorder, and allowing that to be prescribed directly through telehealth to particular sites that are detailed in the bill: veterans clinics, health clinics, corrections institutions, and doorway facilities operated by DHHS. So it helps get treatment to those who need it as quickly as they are seeking help, and then also requires that those patients, clients, follow up with a in-person visit sometime within the year prior to any represcription that would happen for their benefit. I'm fully supportive of this bill, and also supportive of the amendment that you'll receive. Hopefully you'll consider shortly.
Thank you, Senator Kahn. And just wanted to make sure you're aware, you will be introducing the amendment, so you'll have a little time to prepare. Are there any questions for Senator Kahn? Seeing none. Sonia?
Next, we have Michael Auerbach.
Mr. Auerbach, if you'd introduce yourself.
I think you're muted on your end.
Can you hear me now?
Yes.
Okay, sorry about that. Thank you, Mr. Chairman, and through you to the members of this committee. For the record, my name is Michael Auerbach. I'm the Executive Director of the New Hampshire Dental Society. We are in favor of HB 1623 as amended. The New Hampshire Dental Society, as you all know, is a statewide organization representing over 1,000 members of the dental profession, including dentists, dental hygienists, dental assistants, and dental practice managers. Our mission is to advocate for the practice of dentistry and the advancement of the oral health of the public, and these two items are not mutually exclusive. And as you know, responding to the growing pandemic in March, the NHDS recommended to all dental offices that they postpone elective procedures and focus solely on urgent and emergency cases. This recommendation enabled us, as part of the broader community, to flatten the curve in New Hampshire, conserve personal protective equipment supplies, and at the same time, keep dental emergency patients away from emergency departments. However, the lack of access to oral care during this moratorium fostered a dental care crisis, as patients whose appointments were postponed indefinitely experienced worsening symptoms. Thankfully, early in the crisis, New Hampshire Medicaid and Northeast Delta Dental temporarily allowed provisions for recorded and live teledentistry, which helped dentists consult with patients while remaining safe at home. Still, those initiatives were designed to be temporary in nature. Although dentists largely returned to full service care on 11 May, a backlog of patient appointments persists. Committed to the safety and patients of patients and dental team members alike, dental practices are strictly adhering to state guidelines that limit the number of patients in an office at a given time. By making available to dentists teledentistry services, New Hampshire dentists can more effectively assess and triage patients while addressing the ongoing oral health crisis. At the same time, teledentistry only enhances the safety factor, enabling additional protections against the ongoing pandemic. The NHDS greatly appreciates the inclusion of dentistry in this important bill, especially during the ongoing public health crisis, as it underscores the value of integrated medical dental care. We believe that HB 1623, as amended, provides to New Hampshire dental and medical professionals a critical patient care tool. And I therefore ask that you vote it ought to pass. Thank you.
Thank you very much. Any questions for Mr. Auerbach? Seeing none. Thank you again for your testimony, Sonia.
Next, we have Courtney Tanner.
Good morning, Courtney.
Good morning. Can you hear me?
Yes.
Great. Thank you so much for the opportunity to testify. And Senator Sherman, if it's okay, I'm going to testify about the bill as amended.
Sounds good.
So I want to start by thanking the sponsors, particularly Representative Marsh and Senator Kahn, who have worked so hard on the number of stakeholders that have been engaged in this bill. And a thank you to Senator Sherman and Senator Bradley for helping us to get this bill to where it is today. Back in January, Dartmouth-Hitchcock actively supported House Bill 1623 and Senate Bill 555, both of which contemplated telehealth provisions. And as we know, COVID-19 certainly made telehealth imperative. So I first want to start by talking about House Bill 1623. This bill is to address access for MAT for substance use disorders. As you know, Dartmouth-Hitchcock is home for our Connected Care Center, a telehealth medicine center that allows providers in northern New England to access specialty care and provide timely and quality care to patients in our region locally. Our Connected Care team identified a missed opportunity, the ability to provide timely access to MAT services in hospital ERs or clinics. We know that it's important to meet the patient where they are when they're ready to access substance use services. However, some of our hospitals have not been able to do so because of lack of MAT waivered and prescribing doctors. So this bill allows language for regional hospitals and clinics to provide MAT services through telehealth services for those patients in need. Second, I'd like to discuss Senate Bill 555 as originally drafted. this Senate bill originally contemplated reimbursement parity for services delivered by telehealth, and services delivered in person. In mid-March, healthcare delivery services through telehealth became a necessity for the safety of our patients, providers, and our communities. Governor Sununu's emergency order expanded telehealth by broadening the types of providers, allowing a patient to access telehealth from their home, and broadening the type of telehealth that could be used to include audio only. As you can see, the governor's flexibilities are recognized in the language of House Bill 1623 as amended, that I know has not been introduced yet, but will soon. And finally, I would like to thank the carriers for recognizing their material role in this pandemic. I want to thank the carriers for their willingness to be flexible and to innovate, and thank the carriers for recognizing the changing healthcare landscape. There are two important pieces I want to thank the carriers for. The first is the use of audio only. This has been key for some patients who don't have access to necessary technology for audio-visual, and also for patients who don't have access to data or internet or even a signal and have to use a landline from their home. I also want to thank the carriers providing equal reimbursement. This helps to ensure that we can deliver care to our patients in New Hampshire.
Sorry, we hit the 3-minute mark.
Thank you, Sonia. I just want to note for the committee that I did submit written testimony for Dr. Kevin Curtis, who's our medical director of the Connected Care team, and from Mary Lowry, who's the administrator from the Connected Care team. If there are any questions for Dr. Curtis or for Mary, I'm happy to facilitate those. And thank you so much for the opportunity to testify. One final thing, Senator Sherman, Paula Minahan could not get in to testify, and she did have both written and oral testimony. So I just want to note that she couldn't access the.
Okay, I think looks like Alan is working on that. So thank you, Courtney, for letting us know. Are there any, and thank you for your testimony, any questions for Courtney? Seeing none, thank you so much.
Thank you.
Sonia?
Okay, until we find Paula, I will call on Christine Stoddard.
Good morning, Christine. If you could introduce yourself and where you're from.
Good morning, Senator Sherman and committee members. My name is Christine Stoddard, and I am the Director of Public Policy for Bi-State Primary Care Association. I am in Bow at home with 2 small children and my husband, and hopefully they'll stay quiet for a little bit. So Bi-State represents New Hampshire's community health centers, which there are 14 of. And the community health centers serve approximately 122,000 patients at 56 different locations. The majority of their patients live at or below 200% of the federal poverty level. And in 2018, approximately 29% of their patients were insured by Medicaid, 18% were insured by Medicare, and 38% were insured by commercial insurance, and 15% were uninsured. Prior to the pandemic, health centers did not use telemedicine broadly because of the reduced reimbursement rate. Some of them noted that it was as low as 70% of the in-person rate. Because of the pandemic and the emergency order that Governor Sununu issued and what's happened at the federal level, the health centers were able to turn on a dime and stand up telehealth programs within a matter of days. It is important to note that they were able to do this because of the parity reimbursement with in-person visits. Had that not been the case, it is highly unlikely that that would have happened. Telehealth has allowed them to accommodate in-person visits as well, because they can consolidate sites and turn some sites into telemedicine only and other sites into in-person only sites. This is key because the health centers are struggling, like every other healthcare organization, to obtain adequate PPE. And our health centers have noted weekly, we speak to them at least 3 times a week, that until they can access adequate levels of PPE, they cannot return to the level of in-person visits that they were at before the pandemic started. This is especially true for our health centers that have full dental operatories, which is about half of them. And as you can imagine, dentists and dental staff need adequate PPE to treat their patients' needs. This week, our health centers see about 67% of their pre-COVID level visits. And this is an increase of 25% from April 2020. This means that our health centers are starting to see patients in person, but as I noted, until we can access adequate PPE, it's going to be impossible to return to those visit levels. I think I'd end, I know I'm coming close to my time, that Bi-State works to expand access to care, and that's exactly what telehealth does. It expands access to care. When you think about how you and your family members need to access care now and moving forward, it's not ideal if you're high risk to have to travel in person to an office to access that care, when that care can be done from the comfort of your own homes. Our health centers see a large percentage of Medicare patients, and many of whom, as Courtney noted, do not have access to broadband or cell phone service. And we are glad to see that in the amendment, audio only is included, because I think the nature of our state and the rural communities that are in our state, audio only has to be allowed.
Just letting you know the time limit's been reached.
Yes, thank you. And I'm happy to answer any questions if you have them.
Thank you, Christine. Does the committee have any questions for Christine? Seeing none, thank you for your testimony. Sonia, where'd you go? There you are.
Next, we have Jonathan Ruthier.
Mr. Ruthier.
Good morning. Can you hear me all right?
Yes, we can. Thank
Great.
you.
Thank you. Good morning. Thank you, Chairman Sherman and members of the committee. My name is Jonathan Ruthier. I am the Executive Director for CSNI, which is the Association of New Hampshire's 10 area agencies, serving over 13,000 individuals across the state with developmental disabilities and acquired brain disorders. And I'm here to speak in support of the amendment or the bill as amended. This bill will allow providers to add a really important tool to their services toolbox. And in the midst of the COVID pandemic and the stay-at-home order, we have seen in our service system many providers of early supports and services, applied behavior analysis, and other healthcare and home and community-based services having to shift to remote or telehealth services. Many of our providers have reported that while this shift was initially challenging, once people became familiar with the technology, telehealth allowed many services to continue to be provided in an effective manner. And while I think we can all agree that in-person services are still the preferred method of delivery for most of healthcare, there's significant value added when providers and their clients can remain engaged using remote technology. At CSNI, we've been hearing many positive stories from individuals and families and providers related to the use of remote technology since the start of the stay-at-home order. And as a result, we are in the process of developing a survey for individuals and families to let us know what that experience has been like and whether they see a benefit to having the telehealth option available as one item in an array of service choices. House Bill 1623, as amended, would establish the regulatory structure for telehealth to be accessible to Medicaid recipients by ensuring that providers can utilize this and be reimbursed at the same level as an in-person visit. It would also provide the means for the commissioner to develop rules that would protect Medicaid recipients from any potential abuses or misuses of this service option. In summary, I ask you to vote ought to pass on House Bill 1623 as amended by Amendment 1286S, and I'm happy to answer any questions.
Thank you so much for your testimony. Any questions from the committee? Seeing none. Sonia?
Next, we have Paula Minahan.
Paula, welcome. Please introduce yourself.
Thank you. And Paula Minahan, I am the Senior Vice President, State Government Relations for the New Hampshire Hospital Association, representing all our community hospitals as well as specialty hospitals. The Hospital Association is in strong support of House Bill 1623 as amended, and we do want to thank the sponsors of the original bill, Representative Marsh, as well as Senator Kahn, for introducing his bill, Senate Bill 555, that these two bills have been combined. We also want to thank very much the co-sponsors, including Senator Sherman and Senator Bradley. I will basically just indicate our support and note that the carriers have been very responsive when the governor declared the public health emergency and issued the emergency order number 8 that has been incorporated into this legislation. And they were able to begin quickly and effectively covering and reimbursing services provided via telehealth. And our hospital association and our members are very grateful to the carriers for supporting the providers and patients by ensuring that services provided via telehealth were covered and reimbursed during this pandemic. The amendment includes also a creation of a commission. We are supportive of this commission and appreciate that the commission will be able to review teledata in a comprehensive manner. This bill is vitally necessary, especially during this pandemic, and while it incorporates House Bill 1623 and Senate Bill 555, it also codifies the emergency order number 8 provisions into law, and we ask the committee for its support. As a result of the pandemic and the actions taken to expand its use, telehealth services have become an important part of the healthcare delivery system, and as many experts have predicted, telehealth is here to stay, which is why this legislation is so important to ensure patients are able to get the right care at the right time in the right setting, which may ultimately be in the safety of their own home. Thank you very much for the opportunity to provide our comments, and I'm happy to answer any questions.
Thank you, Paula. Any questions from the committee? Seeing none, thank you for your testimony. Sonia?
Thank you.
So I don't see my next two speakers on the list here. They are Jacqueline Lafleur and Daniel York. If either of you are calling in on the phone, if you could press *9, that will raise your hand so that I could identify you. In the meantime, I will call on Kevin Wheeler.
Good morning, Mr. Wheeler. Is he muted?
Perhaps on his end.
Good morning, Mr. Wheeler. If you can unmute and introduce yourself.
Good morning, Kevin Wheeler here. Are you able to hear me?
Yep.
Thank you. Sorry for the delay. My name is Dr. Kevin Wheeler. I am Executive Director of Watson's Health Plan. We would like to express our support for the bill as amended as well. We have seen several benefits of increasing access to telehealth, including dramatically reduced incidence of patients, excuse me, failing to attend their appointments. We anticipate some reduced need of non-emergency medical transportation, and we foresee an increase in access to much needed care for our over 88,000 members across the state. While we are supportive, we do have 3 brief suggestions we would like to make. We submitted these in writing as well. Number 1 is we agree with the suggested language from DHHS as expressed by Dr. Ballard. Number 2, in part 3, E and F, that language anticipates approving all modes of telehealth, including audio and video or other electronic media. We suggest adding the word synchronous so that it would read synchronous communications. That would allow for video, audio only, other electronic media, but would preclude episodic email or written communication that we feel would be more in the vein of normal communication as covered under other types of services.
Kevin,
Yes.
I'm sorry to interrupt, but can you tell us exactly, that's in the amendment that you're recommending, that change?
Yes, that's in the amendment.
And can you tell us exactly where it is?
Yes, Part 3E and F. The quote is all modes of telehealth, including video and audio only, or other electronic media.
Do you remember what page that's on?
I don't have it in front of me. I'm trying to find out from my team. Excuse me one second. So I apologize that I do not have a page number on them.
I'm sorry?
It's page 2, Tom. Line 6.
Thank you, Senator.
Okay, so that's, and once again, can you read to us the change that you wanted?
We would suggest that the line read synchronous communications through telehealth, including video and audio and so on. We believe that the word synchronous would allow for simultaneous communication between provider and patient, but would preclude the possibility of normal written communication such as email, letter writing, texting, that was sort of one way being encompassed in the intent of the amendment. So this would allow for real-time back and forth through the electronic means envisioned in the amendment, we believe, but would be slightly more narrow than the current language.
Okay.
Go
ahead.
No, not at all. Thank you. I appreciate the clarification. The third suggestion that we had was that in part, I believe 13, the bill establishes a commission to study telehealth services. We would like for there to be representative from each MCO on the commission. And that's what I had for this morning.
Okay, just going back to that. Would you be open to the idea of a representative from the MCOs? Because having one from each would put a very heavy weight on the MCOs on the commission.
Yes, Senator, we would be happy to have one representative speaking for all 3 MCOs.
Okay. Are there any questions from the committee for are there any questions from the committee? Okay, thank you, Kevin. Seeing no further questions, Sonia?
Next, we have Evan Greenwald.
Hi, Mr. Greenwald, please introduce yourself. And
yes, this is Dr. Greenwald. I am a psychologist in the state of New Hampshire, and founder of the Counseling Center of New England, the largest private group behavioral health practice in New Hampshire, with over 130 behavioral health providers across 12 offices throughout the state. At the start of the pandemic, we successfully were able to convert 80% of our in-office visits to telehealth visits. And I would like to add my support to this bill, outline the reasons for my support, and ask one clarifying question. Although this bill seems to target substance abuse, I'm hoping by extension it's an expansion of the existing telemedicine bill and includes general mental health as well. I'm grateful that this bill allows for parity of payment to providers, since previously Anthem reduced payment to providers to 75% of in-office rates, which was intended to discourage use of such access to care. And sadly, it was a sufficient reduction in payment to deter providers from offering this service prior to the pandemic and the governor's emergency order. parity is critical to reduce provider obstacles to provide this type of care. This bill is particularly important for Medicaid recipients, along with other individuals and families challenged by mental health issues, because this patient population has significant obstacles to accessing care. And this bill substantially reduces pragmatic limitations to care, including loss of work-related revenue when leaving for in-office appointments, as well as transportation challenges. I really see it as a huge benefit to New Hampshire consumers, beyond simply providing access to care for regions in the state which are hard to access for mental health, behavioral services, and substance abuse services. And I have one question, but comment. I believe I noted somewhere in the bill, and I'm sorry I don't have the detail on it, that there may have been a provision that suggested that this bill was that telehealth would be expanded, but that a pre-existing doctor-patient relationship or in-office visit would have been required in some cases. And I apologize for my lack of clarity. So that, I guess, is a question that I have, if in fact I read that correctly. And if it is in fact in there, I would suggest that somehow that provision be modified or eliminated, since access to telehealth care is needed for patients who are seeking care for the first time and do not yet have an established doctor-patient relationship. I know previously the Board of Medicine restricted access to telehealth services just for that reason, as a protection against what was a concern, 20 or 30 years ago, relative to sort of quote unquote internet related access to physicians who are prescribing controlled substances and things that were in fact potentially problematic, that obviously for the most part there's enough rules and regs governing our practice such that those are no longer concerns. And I just want to make sure that not having a quote unquote physical in-office relationship is a mandatory prerequisite for telehealth access to care. And that concludes my information. If there is anyone who can address my question about that last requirement, I would appreciate it.
Thank you, Dr. Greenwald. We will ask the bill's prime sponsor when he introduces the amendment to address that concern, which I'm sure he will. Are there any questions for Dr. Greenwald? All right. Thank you so much for your testimony. Sonia?
Next, we have Bill Ryder.
Mr. Ryder, please introduce yourself.
Hello, can you hear me?
Yes, we can. Thank you.
Great. Well, good morning, and thank you, Mr. Chairman and members of the committee, for all that you do in creating laws that work to optimize the health, resilience, and prosperity of our fellow citizens. My name is Bill Ryder, and I'm the president and CEO of the Mental Health Center of Greater Manchester. And I'm here today on behalf of both the Mental Health Center and the New Hampshire Community Behavioral Health Association to speak in favor of House Bill 1623, an act relative to telemedicine. Just by way of background information, I think it's important for you to know that in 2017, I testified on 2 occasions when the House and the Senate were considering legislation to decouple New Hampshire Medicaid from the Medicare exclusion of telemedicine in metropolitan or non-rural service areas. I'm very grateful for the legislature's approval of the decoupling proposal. As a result of this action in 2017 by our New Hampshire lawmakers, from October 2017 through 2019, nearly 1,000 Mental Health Center of Greater Manchester patients enjoyed continued care with the providers that they had known for years because they could continue treatment via telemedicine. You see, between 2017 and 2019, the Mental Health Center had 4 providers who would have discontinued practicing in New Hampshire due to life circumstances, resulting in relocation out of state. These 4 providers have a combined over 50 years experience at MHCGM. In other terms, telemedicine preserved the clinical capacity of 4 experienced, well-established psychiatric care providers, 2 physicians and 2 nurse practitioners. Due to the pandemic, in the last 5-month period, January through the end of May, MHCGM clinicians performed services by telemedicine to 5,883 patients, delivering 866 hours of clinical care over 38,605 clinical events. Presently, under pandemic conditions, the mental health center is delivering 64% of its services via telemedicine. 43% of those are audio only, and 21% of those are audio visual. Studies continue to show time and again that telemedicine is a high quality, cost-effective care tool that eliminates wasteful travel time and increases access to mental health care. Presently, the Mental Health Center is engaged in a multi-state telemedicine study through the Vanguard Group. This study will not only give us outcomes on quality and satisfaction for MHCGM, it will give us the ability to compare our findings to those in other states. We feel this data would be very useful to the study commission outlined in House Bill 1623. Telemedicine increases the connectivity between patient and provider. For example, our no-show rate, which usually runs between 10 and 25%, depending on the service, has been reduced to under 5%. Previously, if patients missed appointments, they had to reschedule. Now, if a patient misses an appointment, we simply call them back until we reach them. We can be more effectively proactive with patients who are navigating life with chronic illness and chronic illnesses that are prone to flare-ups. Just think of it, fewer recurrences.
Sorry, Senator Sherman, the time is up.
People can be more productive at work with fewer high-cost services, certainly a win-win. Telemedicine improves the carrying capacity of the system. To illustrate this point, the Mental Health Center of Greater Manchester has 175.
Bill, if you could wrap it up, we do have a 3-minute time limit on testimony. We want to hear what you have to say, but if you could come to a conclusion, I'd really appreciate it.
My conclusion is the pandemic has been the proving ground, demonstrating indisputable access and health benefits for patients, the improved efficiency and patient carrying capacity of the providers that works in combination to avoid the use of higher cost services and hospital inpatient use. In short, telemedicine works to improve the quality of life of our New Hampshire families, friends, coworkers, and neighbors. Thank you so very much.
Thank you. Really appreciate your testimony. Are there any questions from committee members? Seeing none, thank you so much. Sonia?
So I don't see the next person on my list, who is Bonnie Cody. So Bonnie, if you're on the phone, if you could press *9 so that I can identify you. And in the meantime, I will call on Ken Norton.
Hi, Ken, welcome. Can you introduce yourself and give your testimony?
Hi, I'm Ken Norton, and I'm the Executive Director of Nami, New Hampshire. And I'm calling in from my home in Tilton, New Hampshire. And I'm just going to be very brief and say that Nami, New Hampshire is strongly in support of this bill, HB 1623, and its amendment. For all the reasons that previous speakers have stated, we support this bill that simply stated it's really been proven how much it's improved access to mental health care, and we can't go back. And I'll just leave it at that and yield my time.
Thank you so much. And we appreciate everything you are doing. It's wonderful. Are there any questions from committee members? Seeing none. Sonia?
I had Kathy Bizarro-Thunberg signed up, but I'm not seeing her. Kathy, could you raise your hand? And if you're on the phone, could you press *9? Okay, I see a hand. Paula Minahan has her hand raised.
Sonia, sorry. Kathy was trying to assist me with Zoom, so she got off. She's just a colleague of mine, and we're all set at the Hospital Association. Sorry about that.
Thank you.
You're welcome.
So the only folks left that I had again from earlier were Jacqueline Lafleur, Daniel York, and Bonnie Cody. If you're listening, if you could raise your hand. And if there's anyone else, this is all I had signed up to speak on the bill. So I see if you're wanting to testify on the bill, please raise your hand.
All right. Okay. Are there any members of the public who wish to testify further on the bill? Sonia, there are none?
Not seeing any hands raised.
Okay, thank you. We'll close the hearing on HB 1623 and we'll open the hearing on Amendment 1286S. And I recognize Senator Kahn to introduce the amendment.
Good. I'm unmuted. Mr. Chairman, thank you. I know that Amendment 1286 is what is in the calendar. I can speak to it, but there is also an Amendment 1314 that has been prepared by OLS and reflects the input of some of the presenters and addresses some of the questions that have been raised. Which of the two amendments would you like me to speak to?
Does 1314 replace all of the bill, or is it in addition to 1286?
It is a replace all.
Then let's do the most recent one.
Thank you, Mr. Chairman. Then I am Jay Kahn, for the record, resident of Keene, state senator in District 10, representing 15 of 23 towns in Cheshire County. First, I want to thank the legislators who helped work on these amendments, Senator Bradley, Senator Sherman, and Representative Marsh. Together, we've all contributed to this, and I appreciate the input and communication that we've had over the last couple of weeks. And as I go through here, I think it'll be evident that in this Amendment 1314, there are a lot of voices that have...
Senator, just, I think it's 1317.
Great.
Just so we are on the same amendment. I just want to make sure.
Thank you.
Sorry. Keep going.
It'll be evident that there are a lot of voices that have been heard by all of the legislators in this process, and we've done our best to bring those voices into this amendment. If I can, would it be helpful just to run through, and I'll point out where some changes have been made to the 1286 version that's in the calendar?
That'd be great. And also, please address the concerns of well sense while you do that.
So this is amending two parts of statute that cover telemedicine. The first is relative to Medicaid coverage for telemedicine, which is in RSA 167. And the second is private insurer coverage of telehealth, telemedicine services, which is covered in RSA 415. As we roll through the first page, you can see what is covered and defined as telehealth services. And you'll note that on page 1, number 2, one of those requirements for the delivery of telehealth for either remote patient monitoring or other kinds of patient contact does require that the originating site has established care in person. That is anticipated as a part of the statute for Medicaid coverage. And I would further remind us that current coverage allows for reimbursement of store and forward and diagnosis. So screening and diagnosis can take place through a store and forward, meaning a prior recorded event that could be sent to a consulting physician for diagnosis and screening. And for that reason, I don't think we can use Synchronous as a sole source for defining what a telemedicine service is. So the definitions here define what a distant site and an originating site are, meaning that sometimes the originating site will be the place at which the service is being delivered, but sometimes there is a distant site that has established the patient relationship and is also engaged in the screening, diagnosis, or treatment of the patient. The intent of the bill is to take the emergency order and to update these two current statutes for the range of services that are covered in the emergency order. I think other folks have testified how a service that was 1% of our total Medicaid billings just 2 months ago is today, well, maybe 3 months ago now, is today up to 70+% of all healthcare services and 80% of all mental health care services, and is just become a clear means of accelerating and accelerating treatment and diagnosis and consulting with patients, as well as improving convenience for the patients. So it is important that the use of telehealth is inclusive of both video and audio only. And that is in fact a change both in the emergency order and continued in this legislation. And that's on page 2. All of the medical practices covered by the emergency order have been cross-referenced back to the originating practice acts for each of these professions. And that's what's covered on page 2 and again on page 3. There was a comment that from Dr. Ballard about putting remaining consistent language with all federal and state applicable laws for reimbursement under Medicaid. If you notice on page 2 and line 27, that includes the statement that Health and Human Services was requesting. That's in section G. If I go up just a line there to line 24, we've eliminated relative to the behavior analyst certification, a cross-reference to RSA 417. That's not necessary in the Medicaid Act. It's only necessary in the Private Insurers Act. So moving along, the parity legislation that was part of Senate Bill 555 is introduced at the bottom of line, page 2, line 36, and continues through page 3 and 4. Significant here is section, I'll try to limit the sections that I go over, but I think most of these are pretty significant to understanding how parity that is defined in the governor's executive order needs to be defined in statute. Section 3 on top of page 1, an insurer offering a health plan shall provide coverage and reimbursement through telemedicine on the same basis as the insurer provides coverage and reimbursement for healthcare services provided in person. That establishes the parity between a telemedicine visit and the in-person visit. Line 4 defines a reasonable facility fee that could be a part of the billing, and that in the event there's a dispute between a provider and insurance carrier regarding what is reasonable, that there is a procedure taken from the Private Insurer Act and inserted here for Medicaid coverage. This was a suggestion from the Department of Insurance and is an add from the 1286 amendment. And that's on, begins on line 8 of page 3. In 15 is section 5 or Roman 5 that says the combined amount of reimbursement for compensation to the distant site and the originating site shall be the same as the total amount allowed for healthcare services provided in person. This is key to establishing the parity language. Couple more sections that deal with parity, that telemedicine cannot include services that aren't otherwise part of a health plan and reimbursable through. And on line 27 of page 3 is another important rail for assuring the parity relationship, that nothing in this section shall be construed to allow an insurer to reimburse more for a healthcare service provided through telemedicine than would have been provided if the healthcare service was provided in person. We continue forward defining what are the license acts that and those professionals that are covered. Then we get to section 14. Well, I'm sorry, it's new section 4 of this bill, which at the suggestion of many, that we'll get this bill as right as we can in this edition, but recognizing that there's much to be learned about telehealth services, its use, its cost, its quality of care, and that a commission named through this legislation is the best means to assure that data will be compiled. The Commissioner of Insurance is included as a part of this commission. That data will be available then to the commission to assist in developing further recommendations relative to telehealth and telemedicine delivery. That commission is to make a report at the bottom of page 5 on line 28, to make an interim report on December 1st of 2022, and a final report in 2024. And the reason for those two dates is that this current year, the data is obviously going to be skewed by a virus that is causing us to have a stay-at-home order and skewing the uses of telemedicine. But hopefully there's a resumption of how this form of delivery fits into overall system of care, and that we can have more normal year of data by 2022 in the fall, and that could inform the commission and could be beneficial to defining recommendations in an interim report, as well as then the final report with 3 years of data available post-virus and pandemic in 2024. The incorporation then of the underlying bill 1623 and 647, it begins on the bottom of page 5 and continues through page 6 and page 7, unchanged from the version that passed the House in March. We pick up again with a couple of items that just continues down to page 8 and line 27. Two of the what begins there are an analysis of the various practice acts that are part of statute from in the 300s. I'm sorry, and this is still part of the bill. I'm sorry, page 8 and page 9 are still part of 1623. It is on page 10, section 12, that we begin with amending the Practice Acts to incorporate telemedicine into the OPLC, Office of Professional Licensure and Certification, into their statutes. That begins on line 12 and 13. On line 18, it identifies all of the practice acts that are authorized to use telemedicine and telehealth. And then each of those statutes has permitting language to use telemedicine via audio, video, and other electronic media for the purpose of diagnosis, consultation, and treatment. The language that is incorporated comes from the current permitted health provider language that is both in the Physician Act and in the Nurse Practice Act, which are amended on page 11. And then all of the additional acts that are covered by the governor's emergency order are then incorporated on page 11 and page 12. There's an addition that needs to be made to this amendment, and I direct your attention to page 13 on line 1. There's a misspelling of ophthalmic, that it is OPHTHALMIC. Pardon that misspelling.
It's also misspelled in line 3.
Correct.
Do you have, may I ask a question?
Yes.
Just wondering, WellSense had mentioned the idea of having an MCO representative on the commission.
Thank you. and certainly no objection from me, and maybe the other co-sponsors just want to confirm that there's no objection from them as well.
Right. Okay. Anything else on the amendment at this point?
Yeah, I would cover one other, that there is two other things. If you continue on page 13 and down towards line 30, you'll note that, and it begins, I guess, on 26, that when we talked about Medicaid to schools and Senate Bill 684, which is now law, we failed to acknowledge in that legislation, because it wasn't in front of us, the pandemic, that we would be going to remote learning in all of our public schools. It's clear that remote learning is a means of delivery for schools. It is a reimbursable service, and so you can see that there are amendments to both 167, RSA 167 and RSA 186, which both define Medicaid school services. At the bottom of page 13, there's also a new section that just cross-references the dispute resolution section that the Department of Insurance had asked or suggested for the facility fee, that is cross-referenced for the Private Insurer Act to make sure that 415J3, the Telemedicine Act, is cross-referenced as one of the sections that can use that process. Finally, this bill is effective upon passage, so that there is no break in telehealth as a mode of delivery for all of these profession acts once the emergency order has expired. And with that, I'd be glad to answer any other questions. I guess I'd say, Mr. Chairman, I want to thank so many folks for their contribution to this. OPLC, you can see that the interim commissioner of OPLC, Lindsay Courtney, contributed to a lot of the Practice Act cross-referencing that was necessary here, that the Department of Insurance reviewed this several times and offered suggestions to us. The insurance carriers reviewed it, healthcare providers have reviewed this, and to the legislative co-sponsors, including Representative Marsh, I appreciate everybody's teamwork that went into the wording changes and finalization of this Amendment 1317. Thank you, Mr. Chairman.
Thank you, and thank you for yeoman's work in bringing this forward as late as last evening with all of your incredible work on it. Are there any questions for Senator Kahn?
Yeah, I have one.
Yes, Senator Bradley.
Yes, Senator Kahn. First of all, I agree with Senator Sherman. You have done a huge amount of work to get this to the point that it's at, and it's a good bill, and I'm pleased to be part of it. I really appreciate the conversations that we've had and the changes that have been made to ensure that telehealth is reimbursed at a parity level, not a level below parity. And there was language in earlier versions of the bill that could have been interpreted to be above parity. I think the goal all along was parity. And I think that with the changes you've made in this most recent amendment, that's what we achieve. The one question I guess that I would have, I've had some discussion about the effective date for the reimbursement part. Obviously, with the governor's executive order, which I think is likely to continue for some period of time, there is the question of, you know, is a 60-day effective date for the reimbursement, the telehealth, appropriate, or should it be effective on passage? I think it's more of a technical issue than, you know, anything else. There'll probably be testimony from some of the carriers on this, but I'm just trying to get, Senator, your impression on that effective date.
Yes. Mr. Chairman, if I can address that, I think from clients and just patient care, I think a 60-day break would disrupt the mode of delivery to a lot of patients who have become reliant on this form. I think, as I've heard providers, both of mental health and of physical health care, that these appointments continue, and through the use of telemedicine, and particularly on mental health care, that kind of disruption of 60 days, when potentially that would not be available to them, that could be a very disruptive event. And depending when the emergency order does expire, school aged children who are reliant on certain services in school, part of their either mental health or individualized education plans, that a 60-day break at the start of their school year would be a very disruptive event. And yeah, so and we've been operating for 90 days now, under, well, not quite, but we're getting there, 90 days under the emergency order, and moving along pretty effectively. So I think we'd have a hard time justifying to patients that this mode of delivery needed a 60-day break.
Okay, fair enough. I guess let's hear what the testimony is.
Yeah, could I just clarify, Senator Kahn, essentially what we would be doing by doing effective on passage is continuing all of the programs at the current level under the executive order. Isn't that correct?
Yes, it is.
So by waiting 60 days, and we can talk about this in exec session, but just to make sure we're clear, by waiting 60 days, we take the risk of having people go back, depending on how long the governor continues the executive order, go back to prior reimbursement and then come back to current reimbursement.
I think I would just add where I brought up the issue that as long as we're clear in the legislative intent that the reimbursement is sort of folded into, you know, the executive order, that there's no change, then I think I'm pretty comfortable with that.
Okay.
Obviously, we don't want to see a change.
Right. All right. Any other questions for Senator Kahn? Seeing none, thank you, Senator. And I would just like to say a couple of words about this. And I have heard lectures and had colleagues in healthcare who have talked about the impact of war on healthcare. And it's interesting that in virtually every war that the United States has been in, the practice of healthcare has leapt forward in an almost revolutionary way, if you pardon the pun. And this war that we have against COVID is no different. And the among many advances that have occurred during COVID in healthcare, I think the preeminent advance is the use of telemedicine. It has been launched forward as a now essential tool in the practice of healthcare. And I commend Senator Kahn, Bill Marsh, Senator Bradley for really providing the statutory infrastructure to support that as we move through so that all of those advances will be now put into law and supported. I also want to thank the governor for the executive order that made this possible and recognizing that this does represent the future of medicine and healthcare delivery. Not alone, but as one of the tools in our toolkit for how we deal with these kind of issues going forward. I also, having been one of the ones who originally suggested the commission, strongly commend the idea of a commission because there's almost certainty that we will not get this 100% right on the first time through. So the commission is there to support all of the stakeholders to be sure that patients are protected. That's the most important, and that all of the stakeholders then have a say in how we move forward based on data. And that is a solid way to move forward with policy. So with that said, Sonia, if we could move through the testimony.
Kevin Wheeler.
Hi, good morning. It's Dr. Wheeler. Thank you for allowing me to speak again. Thank you, Mr. Chairman, and thank you, Senator Kahn. I wanted to address Senator Kahn's concern about store and forward and synchronous versus asynchronous. I think it is possible to have both allowable in the amendment. I think the language could say something like synchronous communication or communication with the intent for store and forward, and that would likely solve Senator Kahn's issue. And I'll stop there. Thank you.
Thank you very much. Any questions for Mr. Wheeler? I'm sorry, Dr. Wheeler. Seeing none, Sonia?
Dr. Jonathan Ballard.
Dr. Ballard, welcome back. I think he's muted.
Hello, Senator.
Doctor?
Yes, I unfortunately was unable to hear the previous question, but if I was being recognized, again, my name is Dr. Jonathan Ballard. I work as the Chief Medical Officer of the New Hampshire Department of Health and Human Services. The department is supportive of this amendment as presented to you today. We have no further comments. Thank you.
Thank you. Any questions for Dr. Ballard at this point? Okay, Sonia?
Okay. Tyler Brannon.
Good morning, Tyler. Welcome.
Good morning. Can you hear me okay?
Yep.
Great. So Tyler Brannon, Director of Health Economics with the New Hampshire Insurance Department. First, I wanted to clarify that the department doesn't have a position on either the bill or the amended version. When I registered, I had to put in a position one way or another, but we actually don't. And I don't think that'll surprise the committee, as we usually are fairly neutral on bills. And I think the advantages in terms of improved access to healthcare services through telemedicine are pretty clear, so I'm not going to talk about those. The main thing I wanted to do is just make sure that there was a good understanding of where we are today and what the bill actually can do going forward and some of the cost implications. We do have a telemedicine statute on the books that does require coverage for telemedicine services already, and that's sort of independent of the executive order. And that does not limit coverage to any particular provider type. So, so we've got a kind of a pretty good starting point, but certainly the reimbursement parity is new. The audio only coverage is also new. And the big thing though with the amendment, I think from our point of view, is the requirement to cover the facility fee as it relates to services through telemedicine. And there are kind of, two ways this hits us from a cost point of view. The first is obviously a potential inflationary pressure on premiums. But the other side is, remember, the patient is often paying for these types of fees through their cost sharing at the time of service. And unfortunately, this is not a kind of a new dynamic. I think that if you look at the history in New Hampshire, we've seen a greater number of services subject to a facility fee. And the first thing to clarify is that when we think about reimbursement to healthcare providers, you traditionally have kind of a payment that goes to the professional and then a separate payment that would go to the hospital. And that's largely due to a history of physicians not being employed by hospitals. The underlying claim system and reimbursement systems haven't changed very much over time, even though we've seen a greater number of physicians employed by hospitals. Even going back to 2008, there was a fairly strong concern about finding these facility fees on services off the hospital campus. And there was a great deal of emphasis on urgent care centers and some of them billing as sort of offsite emergency departments. In fact, there was a bill introduced and sponsored by then Senators Hassan and Sealy that would have just prohibited the practice because consumers didn't know they were going to face these facility fees and they were increasing costs. The bill didn't pass, and since then, the practice of adding facility fees to services that people sometimes don't expect has grown, and indeed some hospitals even attach them to primary care visits. So I think a bill with an amendment like this, while well intended to ensure that rural hospitals get sort of coverage for setting up telemedicine, it does have a strong potential for an incentive for hospitals to sort of expand the number of facility fees and payments, particularly since carriers would be required to pay for those fees under the bill going forward. It would disadvantage some of the independent practices that aren't affiliated with hospitals because they wouldn't see those revenues. It would also disadvantage any hospital that didn't normally receive a facility fee for something that they're providing through telemedicine, and put them, I think, in a difficult spot where they would more likely add those facility fees to ensure that they were competitive with other hospitals who did add them as well. So I think that's the main concern that we have. The reimbursement parity potentially has some concerns as well, but in terms of how it could impact the dynamic of the market and the opportunity for patients to be involved in sort of the cost-based decisions. But most patients don't feel empowered enough to deal with figuring out where they can go to a cost-effective provider. I know I've kind of hit my 3-minute limit, so I'll stop there and take any questions.
Yeah, I have a question for you, Tyler. You do understand, I'm sure you understand, that the facility fee is not on top of the parity arrangement. So in other words, the total cost of that telemedicine visit cannot exceed or be less than the total cost of an in-person. So that in fact, whether patient is seen in person or the patient is seen through telemedicine, the total cost, that's where the parity is. So it's not as if, although the carriers have expressed this concern and we've repeatedly reassured them, it is not in addition to the parity agreement, it is actually part of the parity agreement. Is that your understanding as well?
It is. But I think that the example we might see is, there's been a strong incentive to incorporate primary care practices into the hospital setting. Whereas today you might have a mental health clinic that doesn't bill a facility fee. They're just a professional site. And in the future, now you've got kind of a pretty strong incentive knowing from a hospital, if they acquired that mental health clinic, they would be billing a professional and a facility fee, or at least there's the incentive for that type of outcome. So that's where you might see some of the inflationary pressures due to just the incentives that are within the bill and the reimbursement systems.
Yeah, I think my question is getting at, you're getting into intent, and I'm thinking of the facility fee as representing similar overhead as the office building that's already incorporated into an in-person visit. So I think there are multiple ways to interpret this, and that's the beauty of having the commission. If the facility fees become a problem, the bill actually has a mechanism within it to address that. And that's, I believe that's also one of the reasons why the commission was put in place, was to address exactly that type of concern. So I appreciate your comments.
Thank you.
And any other questions for Tyler? Thank you for your testimony.
Thank you.
Sonia?
Jake Berry.
Good morning, Jake. I think he's muted.
Jake, can you unmute yourself?
Yes, okay, sorry, can you hear me now?
Yes.
Yes, perfect, all right. Good morning, Mr. Chairman, honorable members of the committee. My name is Jake Berry. I'm the Vice President of Policy at New Futures. As you may know, New Futures is a nonpartisan, nonprofit health policy and advocacy organization. In this role, we work with policymakers, healthcare providers, and families to increase access to quality, affordable health coverage around the state. I haven't seen this most recent version of the amendment, so I'll speak more generally, but I do want to emphasize a New Future's strong support for HB 1623 as amended. I know I don't need to tell you what a lifeline telehealth has been for thousands of Granite staters who've not been able to access traditional in-person care throughout this COVID-19 pandemic. But for many with geographic, physical, and socioeconomic challenges, among others, the kind of obstacles we all face now to accessing in-person care existed long before this crisis and will continue long afterwards. For these people and for our state as a whole, telehealth will be critical into the years to come, not only to overcome this pandemic but to defeat the ongoing addiction and mental health crises facing our state. We support this amendment for a number of reasons, but specifically I want to mention the reimbursement parity and equal reimbursement for telehealth. We believe strongly that this will ensure that our providers are fully supported for the telehealth purposes they provide. In short, this will better position our state to meet the physical and behavioral health needs of our residents throughout this crisis and into the future. And with that, I'm happy to take questions.
Thank you, Jake. Any questions from the committee? Thank you for your testimony.
Thank you.
Sonia?
I have Donna Harbison on my list, but I'm not seeing you, Donna. If you're here or on the phone, could you raise your hand? And you can do so on the phone by pressing *9. And in the meantime, I will call on Heidi Kroll.
Good morning, Heidi.
Good morning, Mr. Chairman and members of the committee. Can you hear me?
Yes, we can. Thank you.
Great. Good morning, and thank you for the opportunity to testify. Again, I'm Heidi Kroll. I'm with Gallagher, Callahan, and Gartrell, and I represent America's Health Insurance Plans, or AHIP. I want to thank you for the opportunity to testify and start out by saying that we're very appreciative of the time and effort that Senator Kahn, Senator Bradley, Senator Sherman, and many others have taken to work with us and to listen to the concerns that we had early on, and for addressing those in the latest amendment that was circulated late last night. I think that it is very helpful to be clear that the intent, that the legislative intent is that the total cost for telemedicine services should not cost any more than in-person services. And there's been obviously some discussion this morning about that. And of course, New Hampshire wants to limit any sort of inflationary pressures on healthcare costs and limit any increases in premiums or higher patient cost sharing. So I also wanted to indicate that New Hampshire health insurance carriers have supported and continue to support telemedicine as an option for improving access to appropriate, timely, and quality care. This was certainly the case well before the COVID-19 pandemic, but certainly throughout the pandemic as well. The carriers have worked very closely with New Hampshire's healthcare providers to dramatically and rapidly expand access to healthcare through telemedicine. As other folks have noted, this has been a way to ease the burden on healthcare systems during the emergency, allowing hospitals to care for people who need it most, limiting exposure for healthcare workers and patients to the virus, and conserving both personal protective equipment as well as other resources. And we appreciate, I know other providers have mentioned this morning, working together with the carriers, and that's worked well. We've heard that, and we appreciate that. We've worked hard to make it a smooth and rapid transition. We have been supportive of Governor Sununu's emergency orders, which are numbers 8 and 15, that expand access to healthcare providers via telemedicine. And those orders talk about coverage parity as well as payment parity. Coverage being what services are available under telemedicine as they are under in-person, and of course, payment parity. And, you know, I think our concerns with earlier versions were that we were concerned about some of the language that we felt was maybe going beyond parity and amounted to something more like parity plus, and some concerns that there were that if only a floor had been created, but there was no ceiling to ensure that the telemedicine services were just on par with in-person services. And so I think the amendment goes to addressing those concerns, to try to clarify again the intent of the legislature, and as Senator Sherman and others have mentioned here this morning.
Senator Sherman, the 3-minute time limit has been reached.
Sorry, I'll try to be very quick. I simply wanted to say that the facility fee is something new that is not in the governor's emergency orders. And as Senator Bradley had indicated, this currently drafted does have an effective date that would be effective upon passage. And I think that there are contractual housekeeping, if you will, as well as potentially some system upkeeping that would need to go beyond where we are with the emergency order. The carriers have no intent of rolling that back. I want to make that clear. And certainly we would not really have the intent or the time to want to try to roll back. So, but if there is any willingness to have an effective date that gets pushed out a little, even if it's 60 days or even January 1st, we would certainly agree to lock in where we are with the governor's orders. Again, some housekeeping to try to accommodate the new requirement under this bill, which says that facility fees are a requirement now, even though they will be under, as you said, Senator Sherman, this kind of parity paradigm where total payment will not be in excess.
Right. Well, thank you for your testimony, and we will discuss that during executive session. But I think the disruption, since this is essentially already in effect, the disruption that would occur, and we have really done an awful lot to meet the concerns of AHIP and Anthem in this amendment, and so I would hope that you would be supportive of this, and we can all work together on the transition.
Absolutely. No, I want to be very clear that we appreciate very much all of the changes that have been made, and we are not looking to roll anything back or step away from where we are today. So that would not be the intent.
Right.
Yep.
Any questions from the committee? Thank you so much, Heidi, for your testimony.
Thank you very much, everyone.
Sonia?
So I had Michael Auerbach signed up to speak to the amendment as well, but I don't see him anymore. So if you're still wanting to speak, if you could raise your hand. And in the meantime, I'm going to call on Adam Martinetti.
Welcome, Mr. Martinetti. I think you're muted. There you go.
Can you hear me now?
Yes.
Thank you. Good morning, everyone. My name is Adam Martinetti. I'm the Director of Government Affairs for Tufts Health Freedom Plan. Tufts Health Freedom Plan is a partnership between Tufts Health Plan and the Granite Health Hospital System in New Hampshire. We offer private commercial insurance in the market. We have a little more than 40,000 members insured in the state. Appreciate the opportunity to offer testimony this morning on the amendment to the bill. I guess I'd like to start just by saying we understand the value and promise of telemedicine, particularly during the public health emergency that has occurred over the last several months, and that's still ongoing. As physician practices and outpatient behavioral health offices closed due to COVID-19, Tufts Health Freedom Plan recognized how critical expanding telemedicine services would be in order to ensure that our members had continued access to necessary healthcare services. Early on during the pandemic, we made the decision to cover all services provided via telemedicine with no member cost sharing. I want to thank the insurance department for recognizing us and other carriers for adopting this policy voluntarily. During the public health emergency, we've taken additional steps to facilitate access to care, such as easing our network restrictions and removing certain prior authorization requirements. In addition to those voluntary steps, many other people who have testified have noted the governor's executive order on telemedicine coverage. We certainly understand, appreciate, and the support, the need for the requirement during the public health emergency. It's clear, as stated in the order, that this was necessary to protect the public's health and mitigate exposure to COVID-19. Many of the provisions, if not all, in the amendment are reflective of the executive order. I would just like to state for the record, we do not feel that these policies are appropriate outside the context of a public health emergency. And I don't think any of the other people who have testified have stated clearly why policies adopted during the public health emergency need to be made permanent. Before I get into specific concerns, I would like to suggest that the commercial sections of the bill be sunset early in 2020, perhaps April. This would certainly give the legislature the opportunity to revisit the issue early next year while allowing the provisions that exist for the public health emergency to continue during the interim timeframe. As for specific concerns, I would say reimbursement parity is certainly one of them. As many people have stated, we are already required to cover telemedicine in the state of New Hampshire. Providers can continue to offer telemedicine services once the public health emergency ends, and they are able to negotiate reimbursement rates for these services as they would for any other service they offer. We believe that mandating reimbursement parity will permanently erode the value telemedicine could offer for premium payers in the state of New Hampshire. These are individuals and small businesses in the state. Individuals and small businesses will pay more in perpetuity for technology that was supposed to facilitate the delivery of healthcare services in a more efficient manner and with lower overhead costs. In the interest of brevity, I will state two other concerns we have. One of which is we do not believe the legislation takes into consideration services that may be appropriate to be offered by telemedicine and services that may not be appropriate. We have heard from our network providers during the state of emergency very real concerns about quality of care. These concerns relate to diagnostic ability or diminished diagnostic ability, concerns related to preventative care being deferred or not being able to be delivered via telemedicine, and concerns about potential overutilization. We don't feel the legislation addresses any of those concerns and considers all care delivered equally, that is, care telemedicine and in-person care is equal. We do not believe that's the case in practice. Finally, I would like to reiterate many of the other concerns folks have raised about facility fees. As Tyler Brennan at the Insurance Department noted, many policy initiatives in the last 5 years have been to eliminate or completely do away with facility fees. CMS.
Senator Sherman, I'm sorry, the 3-minute time limit has been reached. Sorry.
I have 30 seconds. CMS at the federal level has proposed to eliminate them at non-hospital sites.
Excuse me, Mr. Martinetti, if you can just do your conclusion.
Yep.
Appreciate it.
Sure. CMS has proposed to eliminate facility fees. A similar emergency order in Massachusetts for telemedicine prohibited facility fees. As I said, there have been many different policy initiatives to either eliminate or limit the application of them. So for those reasons, would again ask the committee to consider that the provisions in the legislation be sunset early next year, and that we could revisit this so we can better consider the long-term costs for the market. Appreciate your time.
Thank you. Are there any questions for Mr. Martinetti from the committee? Thank you for your testimony. Sonia?
Courtney Tanner.
Welcome, Courtney.
Hi, Senator. Thank you so much for the opportunity to testify earlier. I have nothing further to say. Thank you so much.
Thank you. Sonia?
Oh. Paula Minahan.
Hi.
Good morning. This is Paula Minahan again. I testified earlier, and thank you very much for the opportunity. So my testimony was related to the commenting on the amendment as well.
Thank you,
I'm all
Paula.
set. Thank you.
Sonia?
Gina Balkis.
Good morning, Gina.
Good morning. Thank you. Good morning, Mr. Chairman and members of the committee. I'm Gina Balkis with the Granite State Home Health and Hospice Association, which advocates for home care, hospice, and palliative care providers and the people they serve. Home care agencies have been using telehealth for many years to improve patient care, quickly address emerging health issues, and prevent unnecessary hospitalizations. I was originally planned to speak to Amendment 1286 relative to some concerns that there were inconsistencies between the amendment and the current statutes as it relates to remote patient monitoring and virtual visits by home health care providers. With the introduction of Amendment 1317, we are completely in support. I want to thank Senator Sherman and Senator Kahn for addressing our concerns by assuring that home health nurses who are employed by licensed home care providers are in the list of authorized providers to do telehealth services. That is consistent with the current statutes, the emergency order, and the OPLC guidance that was issued on March 18th. I also want to thank Senator Kahn for including the Granite State Home Health Association on the study commission, and fully supportive of this legislation and really appreciate all the work that has been done with it. And with that, I'll end my testimony.
Thank you, Gina. Sonia. Oh, are there any questions for Gina? Sorry. Hope not. She's gone. Sonia.
Christine Stoddard.
Hi, Christine.
Hi, Senator and committee members. I don't have anything further to say. By state and our members are in full support of the bill and the amendments as you've discussed. Thank you.
Thank you, Christine. Any questions for Christine? Okay.
Jonathan Ruthier.
I have no additional testimony to offer. CSNI is in full support of the bill and the amendments as presented.
Thank you, Jonathan. Sonia.
Paula Rogers.
Good morning, Paula. I think you're muted.
Good
There we
morning,
go.
good morning, Senator Sherman, and good morning, other members of the Health and Human Services Committee. Thank you for the opportunity to make just brief comments. I've listened with great interest, and it's sort of a nice atmosphere. I think from Anthem's point of view, we're still somewhat uncomfortable with the legislation. So we have some cautionary message to deliver, but we certainly appreciate everything that's been done, particularly in the most recent amendment. And let me just get to the cautionary part of it. I'm going to pick up on something that Ken Norton from Nami said, and he said, we can't go back. And I kind of agree with that sentiment. I mean, we're a long way down the road toward parity reimbursement, and the public policy momentum around reimbursement for professional services at parity is clearly there. And I took a quick look around the country at other states that have moved toward parity for reimbursement for professional services. And there are now 10 or 11 states. But what was interesting about it, and it sort of goes along with the governor's emergency order number 8, is they're very simple provisions. And the governor's order is simple. The parity provisions in other states are quite simple. What I think got the plan somewhat concerned is the language that's on page 3 of the amendment. It seems difficult to sort your way through it. And there was this inherent sense, particularly with the mention of facility fees, that there might be something in the dynamic that's represented that would indeed inflate the cost of a telehealth service beyond what would be paid for that same service to the professional in a face-to-face encounter, person-to-person encounter. So we have discussed that internally. I know we've discussed it with Senator Kahn and others, Senator Sherman as well. And we're going to live with this, apparently. And I think then I want to pick up on what I thought Senator Kahn said that was really instructive. And that was the fact that he stated there's much to be learned. And he stated that in connection with the commission. So the commission is going to be vitally important. The reality, though, is that there'll be no serious information coming from that commission until 2022. So I picked up on Tyler's comments, and I'm wondering if going forward, we would agree that we will look closely at the facility fee issue and early on try to discern what the implication is. Because sitting where I'm sitting and even talking with folks at Anthem, I have a very foggy understanding. I just know that facility fee is not present in other states in their reimbursement parity statutes. It was not present in the governor's order. So it's the one watch item that I have some concern about. So with those comments in mind, I just also wanted to pick up on the tenor of the time. And I appreciate the hospitals weighing in and talking about the plans in general, working with them under the governor's order to stand up what was necessary to deal with the parity reimbursement issue. And in turn, I want to compliment the providers because I was still actively employed at Anthem during those early days. I'm now doing work from outside Anthem. And it was very interesting because I myself would get calls from providers who were essentially somewhat frustrated, but mostly concerned about patient access to care. And over a period of about 3 or 4 weeks, while the systems got appropriately adjusted to address the claims coming in and claim suites to go back to address claims that had been processed inaccurately, there was a lot of back and forth, and it was all good tempered. And I'm hoping that same sort of collaborative approach will be with us going forward because there's a lot to learn about telemedicine. As I said, Anthem has some insecurities and cautions about the bill in its present form. But most of all, I'd like to end by saying I appreciate Senator Kahn, Senator Bradley, and Senator Sherman as you worked on this amendment. And those are my comments. I'm happy to take any questions.
Thank you, Paula. Are there any questions?
So yeah, Senator Sherman, I have a question. Paula, so with the changes that Senator Kahn made on page 3 of the bill, line 15, and again on line 27, shall be the same. It's my view, after looking at this language extensively, that if a facility fee is charged, the overall charge, what a carrier has to reimburse, will be the same as the total amount allowed for healthcare services provided in person. So it's kind of up to the provider of the healthcare service, whether they want to charge a facility fee or just simple reimbursement. But in no case between line 16 and line 27 will it be any higher. Is that how you read this? Because that's how I read it.
I read it that way optimistically. I am concerned, though, with the importance of the facility fee in the bill. My understanding was the facility fee was there as a way for perhaps certain providers to cover expenses relating to the transmission of services or the facility you need for the technical facility or expertise you may need around transmissions and communications. If going forward that holds and there's no inflationary factor, fine. I don't, at this point, I've sent this off internally and people kind of scratch their heads. And I think one of the problems is because the bill doesn't break out professional services reimbursement from other fees. For example, if you went to another state, it would say professional services reimbursement must be at parity. Then it would also say fees must be paid, reasonable fees must be provided for originating site and distant site, leaving it up to the market and the carriers. When you weave in facility fee, I don't exactly know whether that's on top of originating and distance or what it really means. And if you do that, are you somehow pushing perversely down what the professional is getting for the way of his or her professional services?
And I guess I would say I would appreciate that. I think that between myself, Senator Sherman, and Senator Kahn, I think all of us have the same goal, parity. And I think we can all make very certain the legislative intent is for parity.
That would be
I agree with that.
very helpful. Thank you.
Thank you.
And I would just commend Senator Kahn for his ability to put into the amendment many different features responding to feedback from all of the carriers. I think he has bent over backwards to really accommodate your concerns. And I know you're appreciative of that. Are there any other questions for Paula? If not, thank you very much. Sonia, do we have an update on how many more speakers there are?
Yes, before I call on our next speaker, Chris Kozak, I was just going to read a few names of folks who have registered to speak who I don't see. If I could, just to save time and ask them to raise their hands if they're
right. Some of the committee members have other commitments, so I'm just, we will be going into exec session at the end of this to deal with this bill. So just wanted to get a time frame.
Okay, folks who have registered who I don't see: Mary Valier Kaplan, Nancy Gill, Jacqueline Lafleur, Daniel York, Eric Stanley, Mark Detzer, Evan Greenwald. If you're with us and wishing to speak, please raise your hand. If you're on the phone, press *9. And in the meantime, I'm calling on Chris Kozak. Oops, sorry, I hit the wrong one.
Welcome, Chris. Chris? Is he having problems with his audio?
Must be. He is unmuted. Chris, can you hear us?
He's not muted at this point.
No. I could call on someone else and we could try him again.
Sounds good.
Sonia and Senator Sherman, there is a hand raised by a phone number.
Um,
Can you hear me?
Yes,
Yeah.
could you identify yourself?
Yeah, this is Chris Kozak.
Oh, hi, Chris.
I think we finally got it through. Thank you for your patience. Thank you, Chairman Sherman and Senators Bradley and Kahn. I thought we had some challenges moving to doing this remote, but in listening to this today, there are clearly more challenges in crafting legislation around making this permanent, and I appreciate all of the efforts that have gone into this. I think most of what I was going to say has been said by many others. I'm at Community Partners, Stratford County. We are both a community mental health center and area agency in Catchment Area 9. We fully support this legislation and the amendment. And I think the other thing I would want to add, and I know this isn't necessarily part of this particular bill, but the opportunity that's been extended for developmental services, as Jonathan Ruthier has mentioned from CISNY, has been interesting for us to learn and see how some of our developmental service clients actually are responding better and able to ease into more public and group settings by use of this technology as opposed to just introducing them directly. So I think at some point it would be interesting if that could be considered as a different legislation as to how that waivered Medicaid program might be able to have some permanency around telehealth services, both audio and video. Other than that, I would just echo what many other people have said, that the access has been improved, our client satisfaction is up, and we really appreciate the work you've done to make this permanent.
Thank you. Any questions for Chris? Seeing none. Sonia?
So unless anyone raises a hand, Jim Monahan will be our last speaker.
Good morning, Jim.
Morning, Senator, and thank you for convening this and all the work you, Senator Kahn, and others have put into this. I'll be quick, and hopefully I will be your last speaker. I've, since the beginning of the pandemic, been working closely with both my current clients and a larger group of healthcare providers, ranging from big hospital systems to small community providers, county jails and county nursing homes. And frankly, without the emergency order around telehealth that was put into place early, I can't imagine what the healthcare system would look like today, and if many of our providers wouldn't have been able to survive this. Much appreciated the platform that the governor created that the Senate today is building off of. All of those folks that I've worked with have been watching closely the development of this legislation. All of them are very supportive of it. I won't repeat what others have said, only to observe that I am concerned about the suggestion of adding synchronous or asynchronous into the definitions. I think at this point, it has a lot of potential to create unintended consequences and confusion around the store and forward language. So it may be something that the commission can deal with and perhaps in future legislation, but I would urge the committee as you move forward with the bill today, not to include that suggestion. So I will leave it at that so that you can get to your executive session.
Thank you, Jim, for your testimony. Any questions for Mr. Monahan? Seeing none. Is there anyone else on the call or on the Zoom among the public who wishes to speak on Amendment 1317S, which, by the way, is available on the website? Anyone? Sonia?
I don't see any hands raised.
Okay, I'm just going to let Senator Bradley know we're going to go into exec. All right.
Would you like a motion to go into exec?
Let me close the hearing first, then we'll do that. Seeing no further testimony, we'll close the hearing on the amendment. Now I'll take it. Thank you, Senator Fuller Clarke. I'll take a motion.
We go into executive session.
I'll second.
All in favor, we have to do a roll call, right? To go into exec? Yeah, okay. Senator Fuller Clarke,
Yes.
Senator Chanley,
Yes.
Senator Gray,
Senator Gray, yes.
and I vote yes.
I'm sorry, I was here too.
Oh, I'm sorry, Senator Bradley.
And this is the, on the
Motion.
amendment?
No, this is the motion to go into exec session.
Yes, yes, thank you.
And I vote yes. Okay, we are now in exec session. Do I have a motion on the bill?
So moved to pass the bill as amended. That's House Bill 1623 FN.
Okay, and do I have a second?
I'll second it, but I'd like to propose one small amendment.
Well, let's do, you're going to be amending the amendment, right? So let's have
Yes.
a motion on the amendment now.
Okay, all right.
So do I have a motion?
I'll second then.
Okay. Okay, so Senator Chanley moves the amendment and Senator Bradley seconds.
And it is 1317S, correct?
Correct. And we have a few issues on the bill. Maybe we could start at the beginning, and I just want to raise, I think there were a couple of typos that we need to fix with a committee amendment, but before that, on page 4 in the commission, there was a suggestion by, and I don't have his name, by Kevin Wheeler to have a representative of the MCOs on the commission. And right now there is a representative of Medicaid through DHHS. There's also a representative of the insurance carriers, but the MCOs are not represented. Is there interest in having a representative of the MCOs on the commission?
I would recommend that we make that additional.
Okay. And Senator Chanley, you agree?
Sure.
Okay. Do we have language or so it would be
Letter L.
Would it
Right.
be 12?
Is it I think it's a number.
It would be after number 12. So page 5, line 6, or line 7.
So a member or a representative or a member, I guess, is there an association for the MCOs or? I think it would be a representative of the managed care organizations.
Yeah, it should be that. And what you could say is as nominated by the 3 MCOs.
Okay.
As
How about as nominated by the MCOs operating in New Hampshire? Because that
Perfect.
number could change.
Yeah, no, that's perfect.
So Monica, are you doing the notes on this?
I am, and I'll go after page 5.
Do you want to read that back to us and make sure we got it?
Yep, a representative of a managed care association as nominated by the MCOs operating in New Hampshire.
Yeah, it's organization, not association though.
Okay.
The next one, is there anybody who wants to put in the word synchronous? I think Senator Kahn was opposed to that idea. I think it's something that the commission could look at if there is a problem that comes out of this. But it sounds like it could have unintended consequences.
I'm good with leaving it out.
Oh my.
All right, then next was on page 13. The Greek derivation of ophthalmic has a PH and a TH. So we need to make those typo corrections in lines 1 and 3.
Fine.
And finally, Senator Bradley, did you want to talk about effective date?
Yes. So I think that we all want to see continuity of the services. So this is what I'd propose, that the effective date be worded as follows. This act shall take effect in 60 days or upon expiration of the governor's executive order 8, whichever is sooner.
So I'm just wondering, why not just say that it would take effect upon expiration of the governor's order? Not sure what you achieve by the 60 days.
I think that, and Senator Sherman can, jump in here too, but I think the point that Senator Sherman was making is that it should, if the governor's executive order continues beyond 60 days, then, we want to establish the new law. I think that was the rationale, Senator Fuller Clarke.
Thank you. Maybe Senator Sherman could speak to that.
Yeah, the only concern I have about this is there any services, are there any services not covered under the executive order, like MAT, that really need to be launched now? So that is the one concern I have about waiting. And I don't know if Sonia, is Senator Kahn still on the call?
Let me check. Yes.
Would anybody object to having him weigh in on this issue?
No, I think that would be helpful.
Senator Kahn, can you help us with the unintended consequences of sticking just with the governor's executive order rather than letting the bill go into full effect?
Thank you, Mr. Chairman, for allowing me to address this. So I think your point, and let me expound on that. I think everyone's focused on the parity part of the bill and not other facets of the bill. And in particular, the base bill of 1623, which does establish MAT services that can be conducted without in-person visits via telemedicine at particular sites, corrections institutions, doorway projects, the veterans and other medical clinics. So that's not covered in the executive order, and was a request that came from the Department of Health and Human Services and others who advocated through Senator Marsh, in particular, corrections institutions. So I think that's a consequence of it. I think, if you were wording this, I think you might say upon expiration of the executive order or 60 days, whichever is less. And that could be another way of addressing Senator Bradley's wording. But I am concerned that the underlying issues of the bill of 1623 get delayed 60 days.
So what if, Senator Kahn, if sections 1 through 3, that's the parity sections, were effective on expiration of Executive Order 8, and we had 2 effective dates, the remainder of the bill effective on passage?
Yeah, it's a way to do it. Again, I hope it was on the way that just flipping it around from where your suggestion that whichever is less, so that
I would keep the 60 days in there for 1 through 3, because what I don't want to have happen is that what we're really doing is we're giving the insurance carriers wiggle room to figure out the parity component and the facility fee. And
okay, I'd be all right with that. So you would say sections 1 through 3, effective on pass, effective within 60 days or expiration of the governor's order, whichever sooner, balance of the bill effective on passage.
Correct.
Got
it. Is everybody okay with that and understands that? Senator Gray, do you have any thoughts on it?
I'm happy.
Okay, and one other wordsmith, Monica, back to the commission, when we say managed care organizations, we should have the word Medicaid before that, because these are the Medicaid managed care organizations.
Okay.
Any other thoughts on the amendment?
Can somebody read back the effective date language just so we all have it?
So what, just verbatim, what you guys had said was section 1 through 3 of this bill shall take effect upon 60 days or expiration of the governor's order 8, whichever is sooner.
And the balance.
And then the remaining sections shall take effect upon its passage.
Correct. Awesome.
Just one question, and all of us probably would know this. Do we need to, say, Executive Order 8 under, the actual stay-at-home order? We may need to do that. That's just a technical thing, just to make sure it's clear.
Right. So is the committee comfortable with leaving the clarification of Executive Order 8 and the wording of that part 2 OLS?
Yes.
Is that what you mean, Jeb?
Yes, I think we all know the intent, that it's effective on expiration of the order or 60 days, whichever is sooner, but they may just have to define the executive order under the emergency declaration. That's all.
Okay. And Senator Kahn, you okay with all of those amendments?
I am. I just would, technically, it is the emergency order 8.
Okay, Monica, you have that?
Well, it's Executive Order 8 under his emergency order, I believe, but OLS can get that correct.
Right.
We know it's Executive Order 8.
Right. I'm looking at the governor's website that says emergency orders 2020, emergency order 8. I know I've had language.
Right. We'll leave that wordsmith up to OLS.
We'll do.
I'm good with that.
Right. And any other thoughts on the amendment? All right. So we have a motion and a second. We'll do a roll call vote on the amendment. Senator Fuller Clarke.
Yes.
Senator Chanley.
Yes.
Senator Bradley.
Yes.
Senator Gregg.
Yes.
And I vote yes. We have a motion ought to pass as amended, which has been seconded. Any further discussion on the bill as amended? All right, Senator Fuller Clarke.
Yes.
Senator Chanley.
Yes.
Senator Bradley.
Yes.
Senator Gray.
Yes.
And I vote yes. That's it for business in the executive session. Do I have a motion to come out of executive session? Oh, Sonia.
Who will you have take the bill out?
Oh, I'll take it out. And it won't go on consent. Sonia, did you have anything else? Monica, anything else? Okay, do we have a motion to come out of executive
We'll
session?
go out of executive session.
Senator, is there a second?
Yes.
Senator Stanley. Senator Fuller Clarke. Do you vote to, we need to do a roll call to come out.
Yes.
Senator Chanley,
Yes.
Senator Bradley,
Yes.
Senator Gray,
Yes.
and I vote yes. Is there any other business for the hearing today? Thank you all. I will adjourn the hearing, and very nicely done from the staff. Thank you again. You all are awesome.
Yes, you are.
Bye, everybody.
Aye.